This summer, we participated in the BME Alliance virtual internship sponsored by Case Western Reserve University and Cleveland Clinic. And here we present to you our DIY COVID mask add-ons. I'm Marina Awad, and I'm part of the class of 2023, majoring in biomedical engineering at the University of Virginia.
Hi, I'm Josh Dolinsky, and I just graduated from the UC Santa Barbara class of 2020 with a degree in biochemistry and molecular biology.
And I'm Joseph Peluso, a class of 2022 biomedical engineering major at the Catholic University.
From speaking to friends as well as our own experiences, we found a number of problems cloth masks have that can be addressed easily. First, cloth masks tend to fog your glasses up when you're outside and breathing into them. And second, they tend to get dirty and sweaty, meaning that they need to be cleaned. However, cleaning them with alcohol or soap and water can damage the fibers, increasing the risk of coronavirus transmission. So cleaning them is not an ideal solution. Therefore, we decided to mold the fit of the mask to the face as well as add another layer of cloth fabric into the masks, but that increases the amount of heat that the masks have, so we also developed a simple, easy way to cool them.
These are all do-it-yourself designs that can be made at home with readily available materials. To reduce fogging of glasses, you will need tissues, a surgical mask, tape, and a pair of scissors. For improved reusability, you will need scissors, a thin piece of fabric, a Sharpie, and Velcro straps. For cooling, you will need a small Ziploc bag and a little bit of dish soap.
For the nose fit, you're going to need a surgical mask, which you will be cutting along the thick bolded line. You will also need to cut the ear straps as well. When you do this, you'll get this kind of nose piece, which you'll be tying around your head for a secure fit. You can put this piece on the outside or inside of your mask as a choice. You can also alternatively use double-sided tape to put this piece on the inside of your cloth mask. If your glasses fog frequently, you can use a tissue, which you will fold it twice and put it around the upper half of your mask, and you will secure it using tape, which you will use both on the inside and the outside of your cloth mask. If your ear straps bother you, you can cut them and then wrap them around your head.
Once you've attached the surgical mask nose piece to the cloth mask, you're going to want to attach another layer of fabric. Cotton is best. Mark with a Sharpie where you want to cut the fabric and then cut it out such that it covers your nose and mouth. That's about maybe 80% of the cloth mask. Attach adhesive Velcro strips to the fabric and cloth mask and then Velcro them together. Alternatively, you could use single or double-sided fabric tape. Remove the fabric whenever you see fit and attach new Velcro or tape and then attach that to the mask. Press down hard and then use something heavy like a book to make sure the fabric and adhesive stick well to each other. And there you go.
Put a small amount of dish soap in a Ziploc bag, then put it in a fridge or freezer until cold. Finally, fold it up and then insert it into the mask or between the mask and the face.
This DIY mask is a great way to make cheap fixes on a simple cloth mask. It's easy to follow with many choices that reduce glass fog, COVID transmission, heat, and makes it reusable.
We'd like to say thank you to Case Western and Cleveland Clinic for organizing this internship, to Nick Lamborn for helping us film, and to Dalton Lute for helping us test masks.
We hope you find our mask modifications useful. Please leave a like if you enjoyed and stay safe.